Hello, welcome to another episode of Lounge with Carlos. Today we are looking at depression. This is a problem that is common to all races, all genders, and all age groups. But today we are going to talk about it in depth and gain a bit of understanding. Today I'm talking to someone who is a specialist in the field. I'm joined by a psychiatrist who has got many years of experience all over the world. I'm joined by Shamira Rehman. She is a psychiatrist and has worked for many years in psychiatry across the world. She is going to help us to get a bit of understanding into the issues around depression, how to diagnose it, what symptoms you expect, how to treat it, how to live with depression, what to do if you've got a loved one who has got depression, probably what you can do yourself if you've got the symptoms of depression. And if you can do us a favor, at the end of this program, I will put an email address where you can get in touch with us. If you find this program has been beneficial to you, we'll be happy to hear from you with a feedback. If you feel you have a story around depression that you'd like to share, contact us on the below email address and we will be sure to help share your story and reach more people out there to help them cope with depression and give assistance through your lived experiences for them to gain understanding and perspective in how to manage and live with depression. Without wasting time, let's head straight over to our interview. Shamira, thank you very much for joining us today on the program. I'm very happy to have you. Shamira is doctor, she's a psychiatrist. Together with her, we're going to discuss about depression and get a bit more insight and understanding to what we mean by depression, how to see signs and symptoms, what to expect, how to manage it, and making life easier for people with depression and people who look after people with depression. Shamira, welcome to the program. Thank you for coming.
Thank you so much, Carlos. Thank you for inviting me.
I'm really excited having you on board, because we get that clinical insight from somebody who has got experience, someone who's in the front line of dealing with some of these conditions. And, it allows us to have that level of understanding on how to help each other within our communities. So I'm looking forward to the discussion ahead. What's your thought of the program, Shamira?
I think it's a really good concept that you have there, Carlos, because as you're aware, you can get so many things on the internet and media, social media, and it'll be good if we have somewhere where you get factual information rather than a lot of misinformation. So I think it's a good thing that you have started this.
Thank you very much. And in all fairness, this program can only grow with, people like yourselves, clinicians, specialists in healthcare, in social care, being involved and supporting this initiative. It also goes a long way if we can convince or get people who suffer from these conditions to be part of this initiative because it's their lived experiences that goes a long way. That is the fundamental insight that we need to empower other people out there who have got this condition. So, let's break it down a bit more. Let's get more into this topic. Would you be able to break down for us, in simple terms, what is meant by the term depression? And can it be classed or differentiated?
So I guess the primary thing that we may need to remember is that depression, a lot of people use it as a lay term as well. Like people may say that I'm depressed or she's depressed. So in that sense, it's something that a layperson or the general public may use that term to describe normal sadness, maybe usually.
Mm-hmm.
So I guess one of the most important things that we may have to remember or understand is a difference between what is normal sadness and normal fluctuations in mood with what we classify in mental health. as depression. Sometimes it's called as major depression. I mean, as human beings, we all have emotions, and we become anxious at times, we get angry at times, we experience joy, and similarly we experience depression, sadness as well. So I guess what is different between that normal sadness and depression is that depression is what we call as becomes a pervasive thing in your life, and it is a deviation from your normal state, and it lasts longer. So I can take you through some of the symptoms that we look for when we classify or diagnose depression.
Yeah, I think that would be quite useful because that's the angle of insight that actually helps. So yeah.
So um, I will come to your question about different kinds of depression in a minute. But normally, when we talk about major depressive episode, as I said, it is a pervasive thing, which means that it sort of eats into your daily life, into your work, your social life, your personal life. So it is a pervasive thing, and that you can't really come out of. Unlike sadness, which will go away once that stressor is over, or it's not a pervasive thing, and it's not out of character for you. It's a normal mood. Um, differences that we experience as human beings. So for depression, for diagnosing the medical condition called as major depression, we follow this diagnostic guideline called DSM-5 in most parts of the world. In certain parts of the world, they follow the International Classification Disorders. So the criteria that I'm going to describe is from the Diagnostic and Statistic Manual, the fifth version, which is the DSM-5. So you need to have at least 5 symptoms out of the 9 that they have sort of written down. So um, the most important thing is that you need to have either a depressed mood, or you need to have what is called as reduced interest in usually pleasurable activities. So reduced interest or decreased pleasure in usually pleasurable activities. Those two, either one of those two must be present out of the 9. So you have the depressed mood, or the reduced interest or pleasure in usually pleasurable activities. Other symptoms that we look for is there changes in your biological functioning, which means that in your appetite, in your sleep. So you will find changes in your appetite. There may be either weight gain or weight loss. Usually it is weight loss. In some kinds of depression, you could have weight gain as well. People tend to eat more. You also have sleep disturbances. So it will be reduced sleep usually, but you could also have excessive sleeping. So people may be sleeping through the day and the night. And so that is the other biological functions that we look for. People may feel really slowed down in their normal activities. So um, they will be much more slower than usual, or sometimes it can manifest as being more agitated and restless as well. So that's another one. Your energy level is going to be really low. Um, so you're easily fatigued, and there will be loss of energy. You also have negative feelings about yourself. So you may have feelings of worthlessness, and I'm not talking about, sometimes maybe we feel badly about ourselves. I'm talking about all of this being pervasive, which means that it is staying throughout. It's not going away, kind of thing. And it is not how you usually think about yourself. So you will have this very, very feeling of worthlessness, that I'm useless, I'm worthless. You can also have decreased concentration, focusing will be a problem. So people who, for example, who may have been able to read and focus on things, will not be able to complete tasks, or maybe not able to focus as well as before. And people have also described loss of memory along with that as well. So you may not be able to remember things as well. And these are all deviation from your usual self. That is the most important thing that you have to remember as well. And obviously, suicide and attempted suicide is a huge part of one of the huge part of having a depression. So you could have thoughts of death. So it may be just that I wish I were dead. I wish I didn't have to live, or even passive suicidal thoughts like I wish that car would come and hit me, or you could actually have suicidal thoughts, say thinking that I want to kill myself, and even sometimes making plans for suicide. So these are some of the symptoms that are part of the criteria for diagnosing a major depression. In children and adolescents, things may be a little different. I'm an adult psychiatrist, so I won't go too much into that, but you must remember that in children, you may not really get depressed mood as such. It could be irritability as well. And in some of the elderly patients as well, we see some sort of irritability rather than them feeling that they're actually sad. And children express depression in very, very different ways. Like I said, I'm not a child and adolescent psychiatrist, but they could have like um, you know multiple physical issues, for example, abdominal pain, vomiting, withdrawal from friends, not wanting to go to school refusal, and things like that. But I won't go deep into that because that's not my area of expertise. So that is a major clinical depression that we look for. But you could also have what we call as dysthymia, which is a much more sustained chronic kind of depression, for major depression to be diagnosed, you must have these symptoms, those 5 out of 9 symptoms, for most of the days, most of the time, for at least 2 weeks. I mean, you can have various other forms like brief depression, but I'm not going to go into those. But generally, for major depression, this is what is required, the duration criteria. We keep the duration criteria primarily. These are all arbitrary things. These are guidelines for us to diagnose, but we keep those duration criteria because you need to sort of differentiate between, like for example, if somebody had a major breakup, you may have these sort of symptoms for a few days, so it comes and goes in waves. So you need to differentiate from that as
It's
well.
it's it's a good insight, what you're explaining. That difference between you just saying, I'm not happy, I'm feeling low, or I'm feeling sad, and that extent of then having suicidal ideation, that element of worthlessness. It's very interesting, touching on that element of worthlessness, because I remember some years ago, I worked as a disability analyst, and I remember talking to somebody regarding, the prevalence of young adults with depression on treatment. And one of the consultants there was saying to me, what you find in the younger generation is that most of their depression is along the lines of worthlessness, because they are failing to compete in the world we live in today, where material has become the common interest. And because of different backgrounds, people feel left out. They feel like they don't fit in this, special box of people who afford things, who've got access to things. And that worthlessness is something that was very common in people of, young adults, and failing to fit in. I mean, do you find the same kind of element, not necessarily in children, but in the younger adult age groups?
I guess you need to be careful there, Carlos, because you could have that feeling of worthlessness as part of your temperament or part of your personality,
Mm,
because of the reasons that you have highlighted. For example, if they didn't have a secure attachment and that self-esteem as you're growing up, for some of the reasons that you have mentioned, or they don't have that um, that caregiver to build up those self-esteem and the self-confidence, and obviously your surroundings as well. So the worthlessness could happen in certain temperaments, certain personality disorders as well.
mm,
um, Worthlessness, as I was mentioning, it is a symptom of depression in the multitude of symptoms that I have highlighted. And as I mentioned, you will need to have, for us to diagnose depression, obviously depression is a mood disorder, so you need to have a low mood or a sad mood, along with that decreased interest in pleasurable activities. So for example, you may find people who have these symptoms of worthlessness but also able to still enjoy things um, with their lives. So worthlessness is a part of depression, but worthlessness alone does not um, constitute or lead to major depression,
Mm.
if that
Inter-
makes sense, Steve.
yeah, no, it makes sense. And you see, which is quite interesting in the sense that for somebody who is, you see, I'm from a general nursing background, so my understanding and knowledge of mental health is very minimal. And as much as I am hosting this program and creating this awareness, it's actually a learning curve for me as well. You know, I'm sitting here as a student, as somebody who's going through a learning process as well. You know, which is a good insight for me. Now, going back
Yeah,
to, when you're talking about some of these symptoms, are there any risk factors that lead to these occurrences of depression?
yeah.
Maybe from gender, race, ethnicity element. Is there any, are there, what are the risk factors that you've come across?
Sure. But if I can just go back, I mean, you talked about, being a layperson to psychiatry or mental
Mm,
health. Even though I'm telling you all of these things, it's not, you can't put people in boxes, and
mm,
you need to remember that. It's not as straightforward science as you would say in a physical health illness, where it is much more numbers and you can measure and you can, for example, you have a clear guideline for what constitutes hypertension or diabetes, or so you can't really box. So it is much more complex than what I'm presenting. So I think you need
mm,
to remember that too when we are talking about mental illnesses, because you
mm,
can't box people into, there are so many nuances to it. So I'm just giving sort of like a bird's view of things. Going back to your question around risk factors, yes, I mean, the studies have shown that women are much more vulnerable to developing depression. In fact, some people say it's 2 to 3 times higher in women than in men. Um, so the reasons for that could be, these are hypotheses. The
mm.
reasons for that could be many. Some say that maybe the men are not as good at seeking help, or coming out with the symptoms and signs of depression, and sometimes they may present with other symptoms like physical symptoms, for example. And similarly, in different cultures as well, the prevalence rates have been found to be different in various cultures. So again, these may be some of the reasons. So with women, obviously they do experience more psychosocial adversities by and large, if you look at it.
Mm.
And childbearing is another thing that may be found to be a risk factor. So hormonal factors could be playing a role in that. So in that sense, yes, there is a gender difference. Different countries have given different prevalences for depression, but they have not really found any differences in race per se. Now, there may be other risk factors. For example, there is a genetic loading. So there is a biological basis to developing a major depression. So it runs in families. So if you have a parent with a mood disorder or depression, there is a higher likelihood of you developing depression. And if you have two parents, that risk sort of doubles. They have done studies in twins where they have found that identical twins tend to have much more concordance rate in
Oh,
depression,
wow.
or
Okay.
mood disorders in general. So there is a genetic and heritable susceptibility to developing depression. It's
Mm.
not that you have a parent, you have to develop depression. It's not like that. But
But
there
it's
is that
something to be wary
susceptibility.
of.
Yeah. So there is a higher risk
Mm.
of a person developing depression if your parent or both parents have depression. And that is the same for majority of the mental illnesses
Mm.
anyway.
Mm. Mm.
But they've also found like childhood adversity. Childhood adversity is a risk factor for very many of the mental health illnesses. So it's not unique to depression, but they do find childhood adversity or abuse or neglect can be a reason. Some studies have found that loss of mother below the age of 17 could be a risk factor for depression. So there are some psychosocial factors also,
Mm.
um, which can make you more vulnerable to developing depression. Not that one, it's not a direct cause, but it is more vulnerability. So you
Mm.
have the genetic vulnerability and you have the environmental vulnerabilities. That's why sometimes, so you need to have both to interplay for someone to actually develop major depression that you see clinically. So
Mm.
you may have a susceptibility. For example, I may have a parent with depression, but my resilience is better. My life is good. I have good coping strategies. I didn't experience any abuse or neglect, or I didn't experience many major traumas. So then my likelihood of developing depression, though I have a biological vulnerability to developing depression,
Mm.
may not be as great as somebody else who have both the factors interplaying. So you have the environmental factors and you have the genetic and
Mm.
biological factors.
And,
So
and
sorry.
that's very interesting what you're saying, because what it does for people, and again, I'm looking back at myself and general people out there, it empowers you, and knowing this information, that the susceptibility to depression. If you've got a parent who's got depression, you may be put in place for yourself, around you, measures to avoid that environmental impact that would lead to that susceptibility of depression to rise. Just that awareness
Yeah.
in general.
Um, Awareness, obviously, it's very, very important, and you can build resilience and you can develop strategies and all of that. But again, a word of caution. It's not because you're weak or your
Mm.
personality is weak that you may, because sometimes the genetic loading may be too high.
Mm.
And it's similar to some of the chronic illnesses that you see in physical health. So, for example, you may have a genetic vulnerability to, like, for example, type 1 diabetes. You may have a genetic vulnerability to it. And however modifications you may make in your lifestyle, you may still be diagnosed with diabetes, but you can help the prognosis of that, or you can make it better by lifestyle modifications.
Mm.
But that
Mm.
does not mean that that person will not be diagnosed with diabetes. So
Mm.
I worry when we say that it is not fully on that person, because you do have a genetic and biological susceptibility
Mm.
and you can't ignore that. So it's not
Mm.
because it's not like I'm not doing enough for myself and that's how I develop depression. So I
Mm.
don't want that to be like a blame or solely responsible kind of thing.
That's very true, Shamira, because it also, I would probably say, it also helps in destigmatizing the whole mental health
Exactly.
and depression in itself. People understanding that some of these things, it's not down to the person per se, but there are other things at play in that person's life that leads them to be in that situation, and people need to have an open mind and appreciate or accept that person for what they're going through, instead of judging them and putting stigma on them.
Oh, absolutely. And that is why I'm cautioning that, even though there are other factors where you can put in place to help with managing depression better, or even once you're diagnosed with depression, you can prevent another relapse. But that doesn't mean that you are not vulnerable to that. So
Mm.
I could develop depression. I'm a psychiatrist. I consider myself as a fairly resilient person,
Mhm.
but I could still develop depression. But I would use the tools that I have, and of course, medication whenever necessary. So
Mm.
it's
Mm.
an interplay of things, but it's not like somebody is weak or not having the tools, and that is why
Mm.
they develop depression. You could still have the tools, you could still put everything in place, but you could still develop depression. But your prognosis and how you deal with it could be better than a person who may not have those tools, or who have significant psychosocial traumas in their life.
That
Yeah.
makes a lot of sense. And it actually leads me on to the next question that I was going to ask you. Being a psychiatrist and obviously working in acute mental health, what extremes of depression would lead to someone requiring hospitalization? And what treatment would they get that is different from community management?
So the main things that we look into when we have to admit a person into hospital, because as you're aware, more and more we want to take this into the community much more than hospitalization, because nobody likes being in the hospital, and it's quite a restrictive environment. So the main thing that we look into is risk factor. So risk to yourself primarily. I mean, in depression, it's highly unlikely that they will be a risk to somebody else, though with children. And sometimes you can have a suicide homicide situation in depression as well. So risk to yourself, or in some cases to others. So risk, by risk I mean if the patient is having suicidal ideations and planning. So we have various ways of assessing risk. So we do assess that risk to self. Um, a risk to physical health in other ways. For example, as I mentioned earlier, depression could lead to reduced appetite, and your physical health may be at risk because of that. And sometimes in serious depression, we see significant weight loss, and people may not be able to eat or drink. So that is like a physical health risk that the patient poses, and sometimes to the significant extent that the person is not able to move or talk even. We call that catatonic kind of state. So that all of that comes under the significant risk. Then, of course, if there are conditions in your home which are not feasible or conducive to being treated at home. So, for example, you may have um, depression, and that may be partly related to or precipitated by things which are happening at home, like, for example, serious physical abuse or sexual abuse, or um, we look at all of those factors to see whether the person needs hospitalization or not. In mild to moderate depression, we could manage at home. Severe depression usually ends up being in the hospital, because severe depression, like I said, patient will not be able to take care of themselves. Their activities of daily living, their eating, drinking, all of those goes down, and also they may have serious suicidal thoughts as well. Again, the suicidal thoughts could happen even in mild or moderate depression as well. So depending upon how serious that suicidal thought is, whether they've got a plan made and the risk of suicide is high, we end up putting them in hospital as well.
That's a very good insight, that for people who suffer from depression, from the people who were around people with depression. Just going back a little bit to the issue that we touched on briefly regarding stigma. Would you be able to talk to us about the dilemma of seeking help and stigma for mental health issues, especially for depression? How would you describe the correlation with possible underdiagnosis?
Yes, absolutely. And as I was telling you earlier, there is this misconception that if I'm strong enough, then I shouldn't be feeling depressed, or things like, it's only a weak person who develops depression and is not able to do any of these things. And I'm feeling like, people around them may think that they are lazy. So that misconception is a huge part of that. And also that I shouldn't be feeling like this, because what do I have to feel depressed about? And you've heard so many times people around you saying that, snap out of it. So there is this huge stigma around what depression is, and that strong people, or people who um, are having everything, everything in their life, should not be feeling depressed. So and somehow it is because you're weak that you're developing depression. So I think that misconception is still very much there, unfortunately, even though awareness has been, we are all trying to build more awareness. So because of that, um, lack of understanding, people do not seek help. And also people are, even with things like suicide, people may not talk about this, or a family member who may have noticed that this person is not doing quite right, may not want to ask about suicide because they worry, again, because of the myths that if you ask about suicide, the person is actually going to get the idea of suicide and they may end up committing suicide because you asked about suicide. So uh, because of these, and especially in men and people from certain cultures as well, where it's considered to be not a strong thing or a good thing to experience this, that barrier is there to seeking help. So yes, stigma plays a huge role. Um, and lack of understanding of what depression is, and that it is a treatable condition, because people don't recognize that it is a treatable condition. They
Mm,
think that, maybe because I'm like this or something has happened in my life and this is why. The person themselves may recognize that, and usually they do recognize that something is not quite right and I'm not feeling like who I normally am and what's
mm,
going on. But because of these barriers, they don't like to seek help. And there is a myth also that, if you're strong, you don't have to seek help, you need to solve everything by yourself. I remember I used to have this poster in my clinic back when I was working in India: strong people ask for help. And I tell it to my patients, I tell it to my relatives, I tell it to my kids, and,
mm.
and I follow that myself. So, yeah, so I guess these barriers are the ones which stop them from seeking help.
I suppose in one way you could look at it and say, when it comes to mental health, there's no such thing as a strong person, is there? We are all susceptible to these challenges,
Absolutely.
or anybody, regardless of gender, age, nationality, profession, social status. We're all susceptible to that mental health challenge that can fall upon us at any time for different reasons.
Oh, absolutely. And you would see, like you said, people from various professions. I mean, high CEOs of companies, or
Mm.
psychologists, psychiatrists, doctors. I've seen across the
I,
across the spectrum. And
I,
as you said, no socioeconomic differences either
Mm. I
for
can
depression, at
imagine
least.
I can imagine being the fly on the wall in your clinics, and just seeing the different people's backgrounds, social status, professions, who end up needing help. And just as a testament of how broad and how at risk we all are with when it comes to depression. Now, moving on a little bit, Shamira, we've talked about, family picking up on signs and symptoms of someone starting to show signs of depression or having depressive episodes or experiences. What can be done at a community level to manage these symptoms of depression in order to avoid, that escalation to acute interventions? What kind of, I know countries differ. I know structures differ and access to resources differs in different countries. Um, so, being a global platform that we are, we're looking at measures that maybe you look at or that you implement and encourage, and see whether we can disseminate and share with others for them to try them in their communities. So, what can be done at community level to manage these symptoms of depression, to in order to, avoid that escalation to acute interventions?
Yeah, I guess awareness and early identification. So, as I said, you need to build up awareness, and you're quite right. I mean, that building up awareness may differ in various countries, like developed countries or developing countries. In my own our home country of India, we use various methods to build up that awareness, including like street plays and reaching out to outreach programs for rural areas. And, nowadays, of course, the media is there. So building up that awareness so that people are aware of the signs and symptoms of depression. So if they are able to pick up that those early signs and symptoms in their loved ones or their family members or their friends, um, like for example, they may find that their family member is becoming quieter than usual or more withdrawn than usual, or they're not eating as well, or they're losing weight. They are lying down most of the time. They're looking tired. So it's I think the family member needs to speak up, and that will happen only when there is awareness that these could be signs of a mental illness, or these could be signs of depression. So they need to speak up and ask, like, is everything okay? I know that in Australia we have the drive for the "Are you okay?" question that we ask. So I guess being aware and educating about the early signs and symptoms. Um, if you're suspecting depression, if there is a primary physician in the country that you're in, then you need to go to your family physician or your primary physician, because um, depression can soon escalate from a early mild kind of symptoms into more serious, where you start having suicidal thoughts and stuff like that. So it's important that you seek professional help. If you're not wanting to go to a psychologist or psychiatrist, or one is not available, then you will need to go to your primary physician. Because of the stigma, I know that in my own country, people prefer to go to psychologists rather than a psychiatrist or even their family physician. That's all right too. Then the psychologist could then refer. But so seeking help, recognizing the signs early, asking the questions to your family, uh, loved ones, seeking help, be it your primary physician. That's very important, because, as I said, treatment is very, very possible. Treatment need not necessarily mean medications. So it could be strategies, it could be therapy, talking therapy, as it is called.
That insight that you're giving us is really important. There are countries out there, there are communities out there who probably deal with mental health issues, with depression for many reasons, and there just isn't significant support structures for people to manage depression in itself, let alone identifying those symptoms, identifying that loved one lying down all the time, doesn't want to get up, doesn't want to eat, or is eating too much, comfort eating and all that. People don't realize that these are actually symptoms to something, and they just let it fester, and then before you know it, there becomes a suicide case, which probably showed a lot of signs prior to that happening, and nobody knew. So
Absolutely.
yeah, yeah,
And
carry on.
going back to one more point, which if I can make one more point,
Yes, yes.
one of the things which Australia does well is having a bit more, training in mental health for primary physicians, and even for medical students. Um, so I think in developing countries as well, when I trained, which was millions of years ago, we had probably a maximum of a couple of weeks or a month in mental health, which is not enough. So I think even when you don't have specialists, primary care physicians can actually do quite a bit if they are trained, or if they are given that education, and that awareness can be spread, and talking about it and destigmatizing it. I mean, I know that in India nowadays, more recently, people who are having a more public platform have started speaking up, um, uh, speaking up very candidly about their own depression journey, and it is much more talked about now. So that's opening up and speaking about it, but also providing that professional training for the primary care physicians who. Majority of the people, I think, would be feeling more comfortable speaking with their primary physician. So even in developing countries, when the specialists are not so much there, um, if your primary care physician is educated and that training is given, and they start building up awareness, go out to the people. Like I said, in India, we used to do street plays in the rural areas through drama and music. They identified which we have done for other physical illnesses like HIV as well. So it's similar to that. It's similar to how we destigmatized HIV, or similar to that we can do with depression as well.
Thank you very much for that insight, Shamira. Look, for the sake of time, depression is such a big topic. Mental health touches so many things. We could go on and on and on. But I think for the purpose of awareness, that basic awareness at what I'll probably class at ground level, I think we have put that message out there. We've sown a seed in people's minds in terms of awareness. And I'm very grateful for your input into the program. I'm very grateful for allowing us that little bit of time in your busy schedule to share your experiences, your expertise with us. I don't know whether that offer that you once suggested about doing a live session at some point where we can get people to phone in and discuss about things in depth, whether that offer will still be on the plate as time goes on.
Yeah, I think that'll be a good idea so that I can answer live. Though, as I keep telling, it's a very nuanced field actually. So I don't want to confuse people too much. But if I can just round up and sort of give this one key message, which would be that there's nothing to be ashamed of if you are having depression. It is very treatable. I would and strong people ask for help. So nothing to be ashamed of. It's a very treatable condition. It's not because you're weak that you're experiencing depression. So please speak up, and family members to please recognize and ask the questions too.
No, thank you very much for that, Shamira. That was a very insightful interview with Dr. Araman regarding depression. I mean, look, even I have learned something. It's the small things that you take for granted that actually mean something, that lead to bigger problems. The purpose of this program is for us to be able to identify these problems, to be able to see them at an early stage and start putting those interventions into place, start speaking about these things, start involving other people in trying to help people with depression. Like Shamira said, there's no such thing as strong people when it comes to mental health, because there are so many things that affect us in life that lead us down that path where we have mental health issues and challenges. So if you have suffered or suffer from depression and feel you would like to share your story, I would be more than happy to share your story. If you suffer from any condition, be it mental or physical health, if you are a clinician and would like to share your expertise on this platform, please email. Remember to subscribe, like, comment, and share the platform. Thank you very much for watching another episode of Lounge with Carlos. Have a good day.